going to start our webinar today. So our webinar in the summer is a career series, and it's sponsored by Beyond Academy College Planning and also by ABLE, Above and Beyond Leadership Organization. It's a nonprofit organization, and we have a group of students and the parents. We do community services, and we do a lot of activities here. And during the summer, we have 7 sessions, and we invited professionals to talk about their careers. Hopefully we can have some exposure to our students, and so everybody get a chance to learn about different jobs, different career. So our speaker, Zoe, Dr. Zoe Huang, is here today. And Zoe, can you speak?
Yes. Sorry.
Okay, that's awesome. No worries. So we started today's webinar. Welcome, Zoe. Just a little bit of introduction about Zoe. So Dr. Zoe Huang is a dentist, and she also has her own office, her own business practice. So this is the one thing we talked about last webinar. Like, she doesn't only have the skills as a dentist. She has to do a lot of business side of work. So today we welcome her to just talk about her career, her business with us, and everything will be recorded. So for people who's not here today, they also get a chance to listen into the webinar in the future. So with that said, Dr. Zoe, just go ahead to start your speech. And for audience, anytime you have any questions, you can put in the chat box. We welcome you to be interactive, so we can chat with you. Okay, Dr. Zoe, go ahead.
Okay, so
do you have a slide you want to share?
Yes.
Okay, so just on the screen, there's a share screen.
Okay, let me go ahead and share my screen.
Awesome. Yes, I can see your screen now.
All right. Let me do the slideshow. All right. Hi, everyone. Thank you so much for tuning in today to know about career in dentistry. Like Dr. Sherry said, I'm a practicing dentist in Dublin, California, and I'm also running the office. So I'm going to give you an overview in terms of, having pursue, if you have interest to pursue a career in dentistry, and so that you can also answer me any questions that you may have. A little bit about myself. So I got my dental degree in Boston University, and also before that I also went to University of Iowa College of Dentistry, and so I have a master in preventive dentistry. And also I was a dentist prior to come to the United States to study in Zhejiang University in China. And besides dental school that I go to, and also receive residency in advanced education in general dentistry from University of Minnesota, and also implant dentistry from University of Illinois at Chicago. So this is my office in Dublin, and I have an office in Dublin. It's called Live and Smile Dental and Orthodontics. So we provide a variety of general dentistry to all age of patients, and we also have specialists. He's an orthodontist, and so orthodontists provide series of orthodontic treatment to children and adults in all ages. So we're located in West Dublin, and I'm fortunate to have a large staff, and including myself, we have 5 general dentists and 1 orthodontist, and also you can see I have large staff from the front office to the clinical team, and we are a group of very happy professionals that really passionate about helping our patients, to improve their oral health, and also educate them about the importance of preventive dentistry. As you know, that I have background in preventive dentistry, so I'm really passionate about start things smaller, before it actually comes to a problem. So that's why we really take our time to educate our patients about early signs of disease, and educate our patient to proper take care of your teeth, because a lot of dental problem can be prevented. And if we caught early, then you can actually avoid a lot of expensive and painful procedures. So that's why we take our time to educate our patients about how to proper care for their teeth, and then also if when we see a problem in an early stage, and then that's when we really to take our measures to educate our patients to take steps and to correct them. And our goal is to have patients live with a beautiful life with healthy, beautiful smiles. And that's why it's called Live and Smile. And so I'm very fortunate, like I said, that I was able to do that every day, that with my staff, and just wonderful patients, and we really enjoy what we do. And like I said, it's a great career, and I really happy that I can share with you that how to really if you really have an interest and really pursue that, and then you can have a very successful and very satisfactory career.
Dr. Zoe, there's a question from a student. He's asking, do you offer internship opportunities for the high schoolers?
That's a good question. We do have, applicants that contact us. So you can definitely, we definitely don't have a official internship program. We do based on the needs of the community. So we do notice that recently we have received a lot of inquiries, and a lot of interest. So we might look into that, because this is something that we hope to help our students, help our community. That's a really good question. Right now, we don't have official internship program, but that's something that we're interested in looking into, since like we do receive a lot of inquiries, and more inquiries about that. Yeah. So
thank you. We hope our students get a chance to work with you in the future.
Yeah, definitely you can contact me through Dr. Sherry if you're interested, and we can definitely look into if that's something we can incorporate into our schedule.
Thank you.
Thank you for the question. So I want to talk a little bit about career in dentistry. So there's different careers that you can actually pursue in dentistry. There's you can be a dentist, but you can also be a dentist and a CEO of the practice. So which means you're not only providing the clinical part of the procedure, which you are leading your clinical team, but also you can be a CEO. Basically, you're managing the office, be an owner of the office. Office manager. So if you if you actually are not interested, maybe, or didn't work out to be a dentist or anything else clinically, but you can consider to be an office manager. So to be on office manager, it's very exciting too. I'm very fortunate because my office manager, she's also a prior dental school applicant. Somehow it didn't work out in her schedule, so she stayed as an office manager. So I'm very fortunate to have her, and she really find very fulfilling, in the profession. And that's why I always tell people that keep your options open. It might not everybody can be a dentist or anything, or clinically. However, there's a lot of other careers that it's possible that you can consider in dentistry. Um, Dental hygienist is becoming very popular because, as you can see, dental hygienist spends a lot of time with the patients, so they develop a really good personal relationship with the patients, and they also in the front line, to prevent dental disease with, and then also inform the dentist about anything that they see in patients, and which we see, a very good satisfaction in terms of a career, and also very flexible schedule. So it definitely gained a lot of popularity among students, and usually they require 2 year, 2 or 3 years extra schools after your college, and it's it's becoming more and more competitive, but it is very good career for people to consider if they're interested in dentistry. Um, a lot of dentists or dental hygienists, before they become dental hygienists or dentists, they do pursue or dental assistant. Um, so dental assistant is it's pretty much a backbone of dentists for us to perform clinically. That dental assistant is really important in terms of providing sterilization, or help dentists set up the trays, and also take X-rays, or assisting all the procedures and then clean up. You know, um, every aspect of our clinical operation, we need wonderful dental assistant, and different specialty like ortho, we require a specialized dental assistant, which is called ortho assistant. Yeah. We also need a large supporting staff. So there's patient coordinator, finance coordinator, or insurance coordinator, um, that prepare all the financial information or insurance, and also coordinating with the patients about the treatment that they need. And they're very important in terms of communication, in terms of communicate the importance of the procedure to our patients, and help our patients to maximize the treatment, and also to maximize their insurance benefits. Um, so majority of patients do have dental insurance. So we do have the supporting staff to help them, in terms of navigate, the complicated insurance world. Um, so we do have all these supporting staff in our office, and so that we can maximize patient experience, and also make sure that all the patient questions will be answered, and also they will have a successful treatment. So as you can see, there's a variety of careers in dentistry. There's really based on your interest, but I would say if you are really interested, passionate about dentistry, definitely keep your options open. And all of this, you can actually find a great satisfaction in your career, and also just a great career. Yeah. So many people ask, like, what it takes to be a dentist. Obviously, um, for me, I would say, the foremost, the most important is you need to have a caring heart. Because people doesn't care how much you know, but they do know, or they do care how much you care. Um, and I really echo that we need to, like when we chose any career, we need to ask ourselves, like, why, right? Why do we want to be a dentist, or why do we want to pursue career in dentistry? It's a very you know, different and special, unique profession. um, so the most important is why, right? Why do you want to be a dentist, or do you want to pursue dentistry? um, Understanding why, that will help you navigate, the long process of application or trainings and everything that go behind that, being a dentist or being in the profession of dentistry. um, you know, with going through so many dental schools and pursuing educations in dentistry, that I do, feel like the dental schools, they're looking for candidates that have enthusiasm, right? They're enthusiastic, that go into the school. They are passionate about dentistry. They are curious, right? They are very good communication skills. As you know, any career in dentistry, you need pretty much every career. I feel like you need to have a good communication skills. You need to be able to communicate your needs to the patient, or your recommendation to the patient, and then also work with your team to perform the procedures and the recommended treatment that for patients. And also, this individual should be responsible, and also possess personal traits that are consistent with being a leader and healthcare provider. Um, as you know, that dentistry is just part of the whole um, you know health of the body. Dental health, right? It's just a window to your overall health. So um, being a dentist, you not only need to know your parts about you know the dentistry, but also you need to know overall, the patient's medical history, what are the patient's, the habits are, or, lifestyle, or all this, because those are the informations that will help you to diagnose and treatment plan. And it's also part of the healthcare provider team, because it's just one of the health profession that's in. So how is it like to be a dentist? So I think a dentist typical day is, we do comprehensive diagnosis, for our patients. So that we take, you definitely have experience, go to a dental office, that we need radiograph, right? We need a series of dental x-rays, and probings, and very thorough examinations, not just your teeth and gums, but also your soft tissue mucosa, oral mucosa, your tongue, your TMJ, your joint, and muscle, and the whole, basically the head and neck examination. Um, so we do encourage our patients to come in like at least twice a year, and so that we, through this comprehensive diagnosis and examination, that we hope to find that everything, if everything is in the normal limits, or it's everything is good, or there is something that we need attention or need some treatment. Once we diagnose the issue, and if there's any treatment that's recommended, we do provide comprehensive treatment for patients who have hard and soft tissue disease. As you know, hard tissue that involve, sometimes involve, the teeth and the enamel, which is the first layer of your teeth, and sometimes involve, the soft tissue. Sometimes, maybe patient will have, oral mucosa or muscle TMJ issues. So there's comprehensive treatment that's tailored for those patients who have these kind of issues, and then hopefully we can resolve that, and then patient will go back to the healthy stage. So some of the procedures you already know that, like fillings, if you patients have, cavity, basically, the enamel or dentin has, that has basically dissolved by the bacteria. And so we have to put like tooth color materials in them, and then to basically repair the tooth to normal function. And, sometimes we need to do crowns for patients that, if, a majority of tooth structure is gone, so that we need to do that, put a crown on the teeth so that the tooth won't fracture. Orthodontic treatment, I'm sure you guys are very familiar with. Like most of the children that go through either braces or Invisalign, some orthodontic treatment to align the teeth to a better position. Not only they look better, but also they're healthier, right? So that's orthodontic treatment. Sometimes, it's recommended children to start their first orthodontic visits at 7 years old, and first dental checkup at first birthday. Yeah, and sometimes we might have to do some oral surgery procedures, and for wisdom teeth, a lot of times because of the modern humans now, that our jaws doesn't develop as much as can hold so many teeth. So a lot of times the wisdom teeth does not have a proper space, and a lot of times they require oral surgery to remove them. Unfortunately, that's the majority of the patients. As you know, you might have heard that we also have different specialty. Now, you go to dental school, you become a general dentist, but also you can pursue to be an orthodontist, to be an oral surgeon, to be a prosthodontist or endodontist, or treat the nerve specialist. It's called nerve specialist, and also periodontist, who's a gum specialist as well. Yeah, so there's different specialists that you can become as you go through dental school. That's an additional 3 to 5 years after dental school. All right, so
I didn't get that. Could you try again?
Okay, sorry about that. Okay. All right. So how it's like to be a dental office staff? As I share with you guys, you can be an office manager. Somehow, it didn't work out, and this is very challenging. I would say very challenging and satisfying dental career, because you not only need to manage day-to-day operation of the office, you also need to manage the human resource, right? You basically need to have a good knowledge of HR, right? And then also you also need to coordinate among the staff about scheduling, or also about the cash flow of the office, or finance arrangement and marketing, as well as coordinating with the clinical team about patients, and make sure that all patient comes in has a successful or happy experience. So a dental office manager is basically a very, very important role in the dental office. Dental hygienist, is a front line of clinical providers. So usually patients, once they enter into office, in my office, they first seen by the dental hygienist, new patients. So dental hygienists provide a series of dental x-rays and, with probings, with a detailed examinations, and they perform, you know, a very thorough cleaning of the teeth and the gums. And it's really important because a lot of times even though we brush and floss, but there's, things that we cannot clean. And dental hygienists use different tools that, help our patients to clean all this calculus which they cannot access. And those are very important because if you have those calculus or bacteria or plaque that's left unclean, then it will accumulate it, and then it will cause inflammation of your gum, and also that can cause you losing bone, and gradually your bone cause bone destruction, so that it will cause eventual tooth loss. So it's really important that we have at this habit of going to the dentist, have your teeth checkup annually, and it's called annual recare appointment. Obviously, it's not just to check your teeth and gums, but also, like oral cancer screening, right? And also you check your TMJ, check, if do you have anything to protect your teeth at night. This past few years has been, challenging for a lot of people, and we do notice there's a lot more teeth grinding and teeth fracture. So if you don't have anything that protecting your teeth, such as a night guard or retainer, and that's something you need to talk to your dentist about. As and we are a lot of dental professionals that have seen all over the country that there's more fractured teeth, and there's just more teeth grinding, as people have so much going on during the day, and it's a neurological I would say response that people grinding at night. Yeah. So that's a dental hygienist is another fun line, to detect those problems. And if we see any fractured teeth, and we use intraoral cameras. Also, we use oral scanning, and we have digital records of our patients, so that we can detect the problems in early stage. So I told you dental assistant. Now, to be a dental assistant, you need to be very proficient in pretty much, everything the dentist does, that you prepare ahead, what the dentist needs in terms of before the patient comes, you set up the room, and, during the procedure, you give dentists everything that the dentist needs to perform the procedure. And then also afterwards, you, thoroughly sterilize the instruments, and which is very important as a COVID situation. Sterilization and infection control, it just becomes, of course, it's always been very important, but it's actually, it's becoming more in the emphasis of our safety of patients. In our office, we do offer COVID testing. We encourage our patients to test before they do the dental procedures, just another safety measures for our patients and for our team, just to make sure that we actually be able to stop the transmission of COVID. But dental assistant is in the the front line of dental infection control, and also just to make sure everything runs smoothly. treatment coordinator, as you can see, they coordinate treatments. They, answer any questions the patient has prior to the treatment, and they make sure that patient have a very successful treatment, and then also follow up with the patient after the procedure. So make sure that patient has great experience and answer any questions the patient has. Financial coordinator, obviously, we want to make sure that patient have adequate financial, support to complete the procedures that they need. And, in our office, we do offer different financing options, because our goal is to help our patients to complete the treatment that needed, and so that we also help them maximize the insurance benefits, which that to minimize their out-of-pocket cost. So that's something that we help our patients do. That we work with the insurance coordinator. As you can see, medical, dental, they're all very complicated, and they have changing policies all the time. That we definitely need dedicated specialists, insurance coordinator, that who can answer those questions, and also to maximize, every patient's benefits, and to help patients to afford the procedures that they need, and also to, to get to healthy or health as fast as possible. Yeah, and then also to maintain, what they have, because the nature, our natural teeth is always the best, in terms of, we want to preserve your natural tooth structure. Office, we're very minimally invasive. We definitely don't want to recommend anything if patient don't need. And, we are definitely treat our patients like yourself, that how we want to be treated. So we want to make sure that the patients have total control in their own decision to treatment, but also they're well educated in terms of, they what they need, and what they want, and and help them in the process of have beautiful and long-lasting smiles. So yeah. Okay, I think that's kind of just an overview of all the careers in dentistry. I think I'm gonna maybe give it back to Dr. Sherry, and if you have any questions, that we can definitely help you to answer.
Thank you, Dr. Zoe. We learned so much from what you are doing. So most of the students have questions about what kind of education is required to be a dentist.
Okay, thank you. Thank you for the question. So to be a dentist after high school, as you know, you need to finish, 4-year college, equivalent to a bachelor degree. And, there's a prerequisite of being a dentist, so that there's an entrance exam, and, also there's there's prerequisite subjects. So like such as I'm sure you need to take biology, those biochemistry, and those biology related prerequisite, doing so if you're interested in dentistry, the earlier that you determine to be to apply for dental school, the better. As you can see, that most of the candidates, dental school candidates, they have prior experience, either to be a dental staff or a dental assistant, so they worked in a dental office before, or they internship, like you said, you guys asked, or they shown the dental school that they have consistent passion about dentistry or healthcare. So I think the admission team definitely interested to see that you have all these activities that, kind of showing you that you are passionate about this career. Besides that, you need to fulfill, all this prerequisites before you apply for either medical, dental. I'm sure it's similar. Yeah, I would say start early.
So after 4 years of college education, they need to go to the like a graduate schools for the dentists, right? That's normally 3 more years.
4 more years.
Or 4 more years, another 4 years, and that includes the internship, right? Like intern training.
So general dentist, to be a general dentist, you know, it's a little bit different to be a family doctor. So to be a family doctor, you require after the medical school, you require 3 years, I believe, residency. If you graduate from dental school, you do have to pass the dental board examination to qualify for licensure. So there's regional board. So in California, there's a Western Dental Board. So you do have to pass the board, which is the written examination, part 1, part 2, and the part 3 is the clinical examination, which is the licensure requirement. After that, I think in California, they do require a residency. So I do encourage, some states, they don't require residency, but I do encourage if you want to be a general dentist, then you go through a residency program, which is a lot of times is either advanced education in general dentistry or GPR, which is a general dentist education program. So a lot of dental schools or hospitals or community centers, they do offer this kind of GRE or AGD program. I do encourage every general dentist, you know, to go through this kind of program because that's going to prepare you for, your general dentistry career. Also, after general dentist, like dental school, you do have 3 or 5 years of specialty program that you can consider. Those does get very competitive, so you do need very good GPAs through dental schools and very high recommendation letters, and also part 1, part 2 examinations.
So if it's a general dentist, training is after 4-year college, there's another 4-year dental school. And after that, as you said, you recommend students to go into the residency program. So that's like how long? A couple of years for residency?
General dentistry residency, usually 1 year.
1 year, okay.
However, I do see, it's still not enough, inadequate to prepare you to be very successful in clinical because, as you can see, it depends on your interest. I would say, after 1 year, you can do some general procedures like fillings, crowns, or some simple procedures. However, if you want to get into implant dentistry or which a lot of general dentists do nowadays, and it's kind of part of day-to-day practice, then you do need to select a program that's really good at implant dentistry if you want to just add to your toolbox different procedures that you can provide to a patient.
I see. So how about for dental hygienist? What's their required training?
Dental hygienists, I know most of my staff, they have a bachelor degree, and then they apply to a 2 to 3 years a dental hygiene program, and that's affiliated to either dental school or a different college. They have dental hygiene program that you do need to finish some prerequisites, like I said, and then also whole application process.
Oh, so we got a question from Grace. Grace is asking, how can I prepare my high school? How can I prepare my high schoolers to pursue a career as a dentist? Are there classes he should take and activities he should do during the high school? Like what's a good recommendation for high schoolers?
Yeah, that's a very good question. So I would say first ask, like the students need to understand, kind of the what it's like to be a dentist, and also, why does she or he want to be a dentist? As you know, dentists and other health providers, they're very different in a way. Is dentists use a lot of hands, so we do a lot of procedures in our hands, right? We do a lot of hand-eye coordination procedures. So and then we spend more time chairside with the patients. um, I think that's also something that I love to be a dentist, because I get to talk to the patients more than a medical provider most of the time. That you definitely have more personal connections a lot of times with the patients. That's something different. And then also you use more hands. Um, so I think understanding why you want to be a dentist, or it's if do you like hands-on procedures. I think that's really important. Once you see which profession you want to go, that you decided, okay, I want to pursue dentistry. I think very good, obviously, to contact shadow in a dental office, or you know um, if there's any you know um, a lot of times that in the dental society, local dental society, we or like our office, we do offer, like sometimes we do the charity work. So like we host Give Kids a Smile every year, that we provide free dental care to patients that's underserved, which is children. A lot of times the family have difficulty that obtain preventive dental care for them, and so we offer those free dental care to the patients. So we volunteer in these kind of events, or check out local dental societies. A lot of times we um, do those California dental care. We offer free dental care to underserved populations. You can volunteer in those kind of events or community outreach events. Um, just a lot of charity or community volunteering work. Um, I think either health related or dental related, that just to get to know the needs of the community. Um, I think that's a really great way to build your passion.
Okay, thank you. I think also for the classes to take as a high schooler to prepare for the dental career would be like biology, as you mentioned, biology, chemistry, um, this type of science classes. Yeah.
Mm-hmm.
And also communication, as Dr. Zoe talked about, it's always important, communication, those kind of information, and use your hands, right? So you need to be pretty handy, those other things. And okay, so that's a very good question for this dentist. Another question I just want to ask is, so for a lot of students, they are not sure they want to be a dentist. They might be only interested in the medical field, everything. They don't even know exactly what they want to do. Can they just go to a school, like study biology to start with? After they got a degree for biology or pre-medical college, like a bachelor degree, they can have a choice. They can choose either be like a dentist, or they can choose other medical field. Is that something flexible?
I believe there's some overlap. There is. I know some schools have pre-dental programs. Um, like I think as long as it's a healthcare related, and there's similar prerequisites, and just if you, I think in high school, obviously biology, science, those are all good. After you go to college, obviously you need to look into specifically which school and their requirements are, and and then also take the prerequisite or of the school that you want to get into. Obviously, you look into that first.
Okay, thank you. So another question for you, Dr. Zoe. So you were trained as a dentist, but later on you have like when you do you open your own office, so you have to learn those business skills, right?
Mm-hmm.
Like what kind of business skills you had to learn, and how did you learn those things?
Yeah, it's a good question. So dental school that definitely doesn't prepare you to be an owner, to be a business owner. That's something that also I wish I learned more than started early, right? Actually, even as a high schooler, that have some sense of being a entrepreneur, or have some financial sense, right? I have some finance, knowledge about personal finance, or sense of what is the business is like, right? I think those are very beneficial to prepare you for the adult world. Also, I think it's something that in dental school there's just so much that you need to know to be clinically that qualified to get your license, and to learn everything that you need to be able to see patients. There's just 4 years is just not enough, because you not only need to know medical knowledge, but also you need to learn your dental skills, right? So it's just not enough enough time, or just enough emphasis like to learn how to be a business owner. So a lot of times that require you to take continuing education, and also in the business management. And I do have personally, I do have consultant that's helped me to get to to successfully manage a business. So it's just something it's not that I learned in dental school yet.
Yeah. So with that said, I just want to share a little bit of my experience too. Like you don't have to know everything to be a business owner. Like Dr. Zoe, she is specialized in the dentist skills, but she said she can get a consultant, she can get a business partners to help her on the skills, like business skills, whatever, marketing skills, and the communication, those kind of things, and office to do the office management. So this is one thing I want to share with you. Like if you don't know anything, you don't know something, it's okay. As long as you can learn how to do a good teamwork, find the right people to complement your skills, you can still do it. And that's very important. So with that said, I think we got a lot of questions covered. If you have a audience, if you have a final questions, it's time for you to ask now, because we got a lot of things covered. So Dr. Zoe, another thing for you is how many patients you have right now? Like there are thousands patients, hundreds patients?
Yeah, we have, I believe we have over 3,000 patients.
Wow.
Yeah, in my office. We have established for a while, so we're very fortunate that.
How many years?
I think started in 2011.
2000, so it's over a decade already. Mm-hmm. So you're always in Dublin, right? For your business?
Yeah, that's in West Dublin. Mm-hmm.
Oh yeah, very nice. So I probably will switch my service to your place soon. Yeah, before I know nothing about, like that's another thing why we do this career series. Like even for our adults, we don't know so many things, right? Like before I talked to Dr. Zoe about the different dentists, different roles of the office, I didn't know myself. I just know I go to dentist office, they fix my teeth. That's all I know. So this is very meaningful to myself as well. Okay, so I haven't seen any additional questions. So I will just stop here. And then we want to thank Dr. Zoe to share your career experience and to help answer those questions. And we really appreciate it. We wish you the best success in your career and in your business. And thanks again for helping us out. Thank you. Bye-bye.
Thank you.
Bye-bye. Yeah. Everybody, bye-bye. So that's the end of our webinar series in this summer. We'll continue to do next summer. Thank you. We'll see you next year, though, Dr. Zoe, if you can get time for us.
Thank you.
Bye-bye.
Bye-bye.